Hello, everyone, and welcome back to Move Daily Talks. I'm your host, Tracy Steen, and on the podcast today, I'm interviewing Dr. Richa Mittal. She's the founder and medical director of Radiant Health Weight Loss and Wellness in Texas, where she treats metabolic conditions, diabetes, fatty liver disease, and obesity, and not as moral failings, she says, but as a complex, chronic medical condition requiring thoughtful, personal care. I think that's really important. We've heard this conversation shifting over the past few years, and I'm really interested in diving into questions about GLP-1s and weight loss medications with Dr. Richa. So let's welcome her to the podcast and get right into it. Well, thank you so much for joining me on the podcast here today. I'm excited to talk to you. I've been following you on Instagram for a bit. So, folks, I'll make sure that I put the links in the description below. But follow Dr. Richa over there. She puts out great content. She interacts with stuff. I'll always see your comments below, and I'm like, yes, queen. Yes, I love what you're saying. So I thought I'd just love to have you on and chat a little bit about this. We're coming into the new year here, so 2026, and a lot of people will definitely have those weight loss goals, those fat loss goals, and a lot of people will do it very extreme in order to get those results because they're uncomfortable today, so they want to change quickly. Of course, we know that is not the best way to go about it, but yeah, we're going to be talking about all of that today as we dive in here. But I'd like to start by just asking you this question. So my motto is move daily, and we're moving daily. Little drips of water on the stone that hollow it out, not through force, but through persistence, says Ovid. We're moving daily in fitness, wellness, and nutrition. Okay. So what does move daily mean in your line of work? How are you helping people move daily?
That's a great question. And thank you so much for having me on. I'm excited to talk to you. To me, that presence in daily life is the first kind of cornerstone, if you will, of any health habit, including movement. And when I think about movement daily, I'm thinking about not just formal exercise, which I think everyone's mind goes to that first. And, it's not always feasible to maybe have a formal workout every day. But of course, we all do our best in that department. But also just getting more inherent movement throughout the day, being less sedentary. I think both of those goals. With a lot of my patients, we talk about muscle moments or movement moments. And it's a great way to just think about small ways within which we can move.
Yeah, absolutely, it does. You said presence in daily life. Why is that so important?
Well, I think that big goals can be a big deal. And when we think about action and actually taking movement or nutrition or sleep or any type of health habit goal, keeping it in mind every day and then taking little steps, I think that's much more meaningful than maybe lofty goals that we may stick to for just a little bit and then we kind of, hang up to dry because they don't feel feasible to actually implement.
So we think so much about how our environment in our past and our how we grow up, what our parents have demonstrated for us, how much that influences our ability to stick with, habits today that we know we should or that are healthy habits. How much do you see that our past influences our present behavior?
Yeah, I think it's a huge part of things. Obviously, if we can make things more of an inherent habit or even a part of our identity as far as who we are as people. For example, I look at my children and I try to teach them how to build a healthy plate because I also learned like, oh, our meal needs to have vegetables or fruit. And this is how we care for ourselves. And a lot of that is learned, but it doesn't mean that if we didn't grow up that way, we can't change and teach ourselves that. And I think part of how we define ourselves, as far as I'm an active person or I'm a person that cares about my nutrition, and then we take small steps throughout the day to kind of be that person. I think that it absolutely does make a difference, though, as far as our environment that we set up now and the one that we grew up in.
Yeah, it's creating that identity habit, isn't it? Like people like us do things like this. We're fit and healthy. This is what we do. and beginning to see that as a perpetual pattern in our day to day when we wake up to when we go to bed. How important is habit in moving forward, do you think?
Yeah, I think the habits are important. I think that a lot of times we have very strict, inflexible ways of how we judge our habits.
Mm,
And I think that if we can allow ourselves grace to be imperfect while we're working on habits, we have a much higher likelihood of starting to make real change in those departments, as well as almost proving that identity statement that James Cleary talks about in the book Atomic Habits. How
mhm.
can I, multiple ways throughout the day, prove that I am that person? And those small micro habits then add up to that identity.
Yeah, like shame doesn't work very well, you know. But
No.
what you said, but that internal dialogue to say, "You're such an idiot, you're so stupid, why didn't you do this? I can't believe I didn't do this again." And we berate ourselves internally. I mean, I have used that language in my head toward myself. It's really easy to do.
Yes, I have too, and I think a lot of times when I talk to my patients or even myself, I'm like, "What would you say to your best friend if they were
Yeah.
struggling?" We
Mm.
would come from a place of empathy and caring, and we should do the same for ourselves.
When did obesity get the label of disease more than just, oh, you don't have self-control? When did that all shift? Because we are seeing that. I mean, I know that it has shifted years and years ago. I'm not exactly sure when. I'm sure you would know more than I, but yeah, it's interesting because I think a huge subset of people still see it just as a lack of discipline, a lack of self-control. And yet organizations are have labeled it now as a disease. Could we talk about that? When was it labeled a disease? And then what did that label change, like in terms of insurance, stigma, treatment plan, access, and all of that?
Yeah, historically as a society, of course, obesity and weight have been looked at more as a moral failing. I'd
Yeah.
have to look up the exact year, but the American Medical Association was the first one to come out, I think in the early 2000s, to basically come out and say obesity is a chronic relapsing disease. And, as usual, our society runs in a lot of pendulums back and forth. And even the healthcare system and medical providers have not really been properly educated on weight stigma and the fact that obesity isn't a moral failing.
Mm,
And of course, when people are facing stigma who are in larger body sizes, they avoid care. They, feel judged by their healthcare providers and their team, and it doesn't create a collaborative environment to seek medical care for other issues, let alone for, say, maybe weight management. So, the way things have changed is that now we do have insurance coverage, although that's kind of shaky these
yeah.
days with medical plans changing things. But, medication coverage, number one, being at least included in certain plans, although that's not universal, and there's a lot of room for improvement there. The fact that we have medical societies that have clinical guidelines on how to help other healthcare providers learn about what are the different thresholds for treatment and
Hmm.
what is the evidence-based approach to treating obesity and, health conditions that will improve with treatment of obesity. So it's been an evolving field for sure. When I first got into it, it was really kind of very, very new. And
Hmm.
I'm glad to see, a lot of positive change happening in that direction. Although I still think there's a lot that as a society and as healthcare providers, we need to be doing better.
Like what?
So, I think like in the scene of GLP-1s, right?
Yeah.
Say like these injectable medications that are out now. And we've been prescribing them for the treatment of type 2 diabetes for a long time now. But even within, say, the last decade, a lot of us obesity specialists were treating with these GLP-1s off-label for metabolic disease and obesity. They're not new, but they're new to the scene in terms of the social media and internet trends and fads that, unfortunately are part of our culture. And I think that there's a lot of people on them who are using them in a short-sighted manner. They're not really treating any health conditions per se. They don't even really have overweight or obesity at times. and maybe it's more of an aesthetic thing that they're doing. I don't think that's obviously the way that these medications should be used. Number
Mhm.
two, they're actual medications. They're not just like a peptide that
Yeah.
people can inject into their bodies. There are real side effects and real health impacts. And then I think as a consequence of this mindset, in addition to stigma and kind of us lagging behind, there's a huge swath of people who would benefit from the medications who either face stigma in getting them, or maybe they don't feel like they should be because the medications get a bad name. And then, of course, the coverage aspect is a very practical concern. So there's a lot of underutilization in people who could benefit, and there's overutilization in people who shouldn't be on them.
Right. Yeah, that must be a very interesting thing to be observing. And we're all sort of observing it as well. Well, there's a lot of celebrities who, I mean, I don't know if they're on it or not. I mean, who's to say, right? They could just be whatever, but that is the trend that we're seeing, and that's the conversation that we're hearing. We see people, who are becoming extremely thin and almost emaciated looking and thin. And yeah, it seems like that's a big downside. But I mean, it's hard when you're an observer. There's a lot of judgment. I can feel it. So I mean, to be someone who maybe really needs the medication and then to see all of this judgment in the comments of, people taking it, it just must be a very difficult thing to navigate.
I think so. And, for the celebrities, we don't know what their medical history look
Yeah.
like. I don't
Yeah.
know what
Yeah.
their labs look like. And who am I to decide whether they are worthy or should be on this medication? What I will say is that I think the why matters more of the what. So, when it comes to, say, body image, right? People in all shapes and sizes have self-worth and deserve dignity and
Mm,
respect.
mm,
But if we are also giving people, say, not permission, but if we're allowing for people in larger body sizes who are healthy, then we can also accept that maybe there are people who desire a smaller body size and maybe they have health conditions that we don't know that
mhm,
those celebrities might have been facing. I think some of them have come out and said that they did
mhm,
have some, although they
mhm.
shouldn't have to really say anything, but they
I
are
know.
public scrutiny.
Well, that's just it. Yes, I had someone that I knew as well who was prescribed Wegovy for LDL cholesterol issues, and that was surprising to me. I thought, oh, you don't need to lose weight, but by virtue of going on the medication and it was prescribed by her doctor, she did lose weight. And that's the question then. So what's the mechanism there? Was it the medication that brought down the LDL, or was it the amount of food that she consumed going down, or the types of food that brought down the LDL? Like what's the mechanism within that for treating something that's not obesity?
So I think probably both things played a role. For people who are, say, normal weight, where we might say they have a normal body mass index, they
Yeah,
still may have excess types of body fat.
that's
So
true.
when we're thinking about
Real.
genetics and
Yeah.
ethnic background, BMI is not really the best measure, but the mechanism could be that they have a reduction in a type of body fat called visceral fat,
Yeah.
which is inside. And to your point, if they were on a medication that maybe helped them to curb cravings for certain foods and they actively were incorporating healthier options and eating more fiber, that could also contribute to improvement in your friend's LDL cholesterol.
Yeah,
But
for
where
sure.
their doctor may have been coming from was a reduction in visceral fat.
Right, right. So, people listening right now, there's no doubt there is a large group of people contemplating whether they should go on a medication or not. What are some of these guidelines or clinical guidelines that you were referring to that would make us go, okay, perhaps I'll move forward and have this conversation with my doctor because this might be something that could benefit me versus I'm going to really dial in my lifestyle factors, the environment, my food choices, my training, my exercise this 2026? Like, how do we know what camp to pick?
Yeah, so the camp of lifestyle stands on its own always, regardless, in
Both
my book.
camps, folks. That's right. Absolutely. We're with you.
I think that, people in normal body sizes, low body sizes, higher body sizes, we all need to be prioritizing our lifestyle, but sometimes it's not enough.
Right.
So I would say that if you have certain medical conditions Number one, like high cholesterol, high blood pressure, obstructive sleep apnea, prediabetes, diabetes, fatty liver. There should be at least a conversation with your doctor about whether
Mhm.
body composition improvements could maybe have an impact on those health conditions. And then, of course, one needs to look at making sure they're not underweight. Obviously, people who are underweight should not be on medication to cause weight loss. But outside of that, people could be in a BMI category of being overweight. We do have lower cutoffs for certain ethnic backgrounds in terms of Asian and South Asian, where overweight and obesity or excess body fat can occur at lower body weights. And that might be evident by some of these health conditions that I just mentioned.
Mhm.
Those people would benefit from additionally discussing maybe the use of medication to help them along with all the intensive lifestyle changes.
Yeah, because you want to live first and foremost. So if you have high blood pressure or prediabetes, like those are things that, could potentially shorten your lifespan, right? So the goal is to make sure that you can try to reverse those as soon as you can. And if losing weight is going to help us do that, then you're saying that's a good reason to have this conversation.
Yeah, potentially. And then also, quality of life wise, for anybody I've worked with lots of patients who have struggled with weight for a long time. And when they're trying to eat less and move more and work on stress and sleep and all the things, because as a obesity specialist, I'm also a lifestyle medicine doctor. So I never ever have this conversation where they're one or the other.
Yeah, not in a
But
silo. Yeah.
yeah, but when people have been making changes and maybe they have not been successful multiple times, lost large amounts of weight and then regained, there is a missing piece of the puzzle for those
Mm.
people. And that is that our bodies are very good when there's a huge deviation in weight to try to increase hunger. There are certain hormones that go up, like ghrelin, which
Yeah.
stimulates appetite. Leptin levels can be off, GLP-1, and that can result in weight regain. For some of those people, if they had been offered weight management guidance or help with medication, even to help them maintain, they might have seen less of the yo-yos. And it
Yeah.
frees them not only from self-blame, but to help them keep walking the walk.
I think something else that would help free people from self-blame too is just to describe a little bit what are some of the primary drivers of obesity. We did talk a little bit about environment and growing up, and maybe even possibly trauma around that. That can definitely be driver. But what else comes into play in terms of drivers of obesity?
Yeah, so they can start in utero. So certain exposures, mothers with metabolic disease themselves,
Hmm.
like diabetes, can have babies that have a higher risk of metabolic issues and weight gain themselves. Of course, environmental exposures growing up. But even as, busy people, the way that we set up our environment, unfortunately, is a very obesogenic environment.
Yeah.
Not only are we surrounded by a lot of ultra processed foods, we live very on the go lifestyles that sometimes we need convenience. We also tend to have computer jobs. So I think sedentary behavior in the environment makes a difference in terms of setting us up for risk for obesity. And then, there are, of course, others like obesogenic exposures, like certain pesticides are linked to development of obesity.
I didn't know
And
that.
then we think about our psychological health, of course,
Mhm.
untreated anxiety, depression, or history of trauma.
Mhm.
Those play a role. And then, of course, just physical inactivity, not only just formal activity, but like we were talking about the sedentary. And then, I think nutrition choices, yes, a lot of them are in our control. But as far as the weight regulation pathways in the brain that stimulate hunger or help reduce appetite, really do vary person to person. And there can be a genetic component to that, as well as we don't really understand what all is involved in that careful hormonal process where our brain tries to maintain maybe a certain appetite or weight. And then last but not least, sleep and stress play a huge role,
Mhm.
of course, in our hunger and appetite regulation, as well as maybe ways we might cope with stress that can be unhealthy for us and lead to weight gain.
Mhm. I read a really interesting study that was done on sleep and fat loss. And when you're getting under, the optimal amount of sleep, 7 to 8 hours, and you're closer to the 4 or 5, it really does hinder fat loss substantially. It was quite an interesting study. So definitely that happens. Let's talk about metabolic health. Of course, we know that that is such a crucial thing to pay attention to. Could you talk to us about what that is exactly and how do we manage this marker? Like we don't want prediabetes. We don't want insulin resistance. So, how do we avoid that?
Yeah, so first of all, metabolic health, if we kind of think of it in the most simplest terms, is how we extract energy from our food.
Mhm.
And this, of course, is translated into whether we're in an excess calorie environment, we can start to develop problems. If we're in an undernourished environment, there can be too. So when we're thinking about health conditions like high cholesterol, specifically high triglycerides or high LDL cholesterol and low HDL, we're thinking about increasing waist size circumference. So it's really not just about weight gain, but specifically midsection and visceral fat gain, high blood pressure, presence of insulin resistance. So that could mean prediabetes or diabetes. And I would say that even before prediabetes, elevations in glucose or blood sugar and insulin can be seen,
Mhm.
or markers of inflammation going up. All of these together are called metabolic disease when they occur. I would put fatty liver into this as well because
Okay.
it's now called metabolic associated fatty liver because we're understanding that excess fat gain in this visceral fat component and or some subcutaneous, but a lot of times in that visceral fat, that
Mhm.
is what's kind of translating to this metabolic health. And that's why part of the treatment is to think about caloric restriction or reducing the excess on some level,
Yeah.
in addition to qualitative changes to our food and our other lifestyle factors to help mitigate that metabolic disease.
Do some body shapes have higher risk? Like I think of the apple shape or the traditional apple shape where we're sort of round in the middle. And yes, our potential for visceral fat seems to be a lot higher there versus someone who's maybe more of the pear shape where you carry more of your weight in your lower body. It seems to me that you could still carry excess weight, but be more metabolically healthy if that visceral fat is not increased.
Absolutely. So, yes, apple shapes are much riskier in terms of our health, and certain ethnic backgrounds tend to have certain shapes. So, we
Mhm.
have to be a little bit more astute about thinking about that.
Right.
But the pear shape is typically, from a health perspective, going to be a healthier
Right.
body shape.
So, and I think you get what you get there, folks, with your shapes. But good news is that you can always do something about it. You can always move daily in that. Well, let's look at some red flags for diabetes. What are some red flags? What are we looking at in terms of markers? I'd love for you to list a few things that we can look at. Like I'm thinking things like fasting insulin, your waist circumference, muscle mass. Let's talk about a list. And I've got some things I'd like you sort of to dive deep into each of them and explain. So let's talk about what is fasting insulin? Why is that an important marker? Should we know that number? Should we ask for that at our next blood test?
I think it's an important marker because it's the idea is to try to catch things earlier than when the blood sugars start to go up. Typically, people have maybe been sitting in a insulin resistance type of state, which means that our bodies are making insulin, but our tissues are not listening to that insulin. That's what insulin resistance means.
Mhm.
And usually, somewhere between 5 to 7 years, a person may be sitting in that state
Wow.
before they all of a sudden have a lab test where it says, oh, your blood sugar's in the pre-diabetes range. And then the
Right.
conversation starts. So, the fasting insulin with a fasting glucose or blood sugar together can help to assess whether there is something called insulin resistance. So, we can maybe intervene earlier.
It's like getting a DEXA scan, maybe in your 40s. Just let's see where your density's at. Like, are you close to being osteoporotic already? If you are, let's do something about it. I like that. Waist circumference. What should we pay attention to there?
So when it comes to waist circumference, we are looking at different ethnic backgrounds to determine what that goal should be. And
Mm,
typically, metabolic risk is going to go up when Caucasian men and Black men have a waist circumference of more than 40 inches and more than 36 inches for women in those ethnic backgrounds. When we
yeah.
look at Hispanic, Middle Eastern, and Asian and South Asian, those cutoffs are more than 36 inches for the men and more than 31 and a half inches for women. The
Yeah.
waist circumference is kind of a surrogate cheap marker for
Yeah.
visceral fat. So,
Yes.
of course, that's a great screening tool. And then one could do a bioimpedance measurement or a DEXA scan to get more
Hmm.
specific about the visceral fat.
Hmm. Yeah, that you can do that, divide your waist by your hip measurement. Is that a good one to do?
That is also a good one.
Hmm.
Yep.
So very simply, you can just take a measuring tape and measure your waist, then you measure your hips and divide your waist by your hips. And I think for women, it needs to be, well, a good place to be is 0.8. So under that one. And for men, it's under 0.95. Sounds like a good place to be.
That's the
0.
waist to hip ratio. So,
Great. Yeah.
both are going to be good and helping to identify perhaps that apple shape that we were just talking about.
Yes. Let's talk about muscle mass. Why is this important in terms of our metabolic health?
Yeah, so muscle mass is, I kind of look at that. It's the furnace that's keeping everything going. And it's burning lots of calories and energy at rest. And it's also, of course, going to help in terms of, that maintenance that maybe people look for if they're starting to lose body fat. We want to lose body fat, not muscle. And so, muscle is very key. They have our muscle fibers are where the receptors are for glucose uptake or blood sugar uptake. So not only are we burning more calories with more muscle, but we're directly impacting the uptake of blood sugar from our bloodstream. And when we have issues there in terms of our insulin resistance, that's one of the places where there can be more of that, less of the blood sugar uptake, and that subsequently leads to higher blood sugar levels.
Right.
So, muscle is very important.
Hmm. Hmm. You talked about fatty liver. What about liver enzymes? I don't know very much about this. So what's that about? Why is that an important marker?
So liver enzymes are just specifically labs that are checked on your, annual physical or other time, and they may or may not be increased or abnormal if a person has fatty liver. So number one, enzymes can be normal and you can still have fatty liver.
Okay.
If you have some of these other risk factors that we're talking about, like where the waist has gone up, or there are other signs like we just talked about, like blood pressure, or cholesterol, or blood sugar markers, those are all indicators of metabolic disease. And when we start to have a lot of excess visceral fat in that compartment, we can also start to have excess fat develop within our liver. And so that's what's called fatty liver, and it's treatable through treatment overall of this metabolic disease. Why
Right.
do we care? Because the liver, of course, is a very important organ when it comes to, filtering out toxins in our body. We can't live without a liver. But also, over time, there's a subset of people who have fatty liver who will unfortunately develop something called fibrosis. And
Mm.
that can lead to cirrhosis. And fatty liver, nationwide and throughout the world, is becoming the number one cause of needing a liver transplant.
Oh
So,
dear.
this is a very important
Yeah.
um, condition that we want to raise awareness about.
Hmm.
There are certain people that need to worry more about metabolic disease than
Okay.
others. And I just wanted to mention this because a lot of women may not know that having had a history of gestational diabetes
Mm.
increases their risk for metabolic disease and diabetes. as well as women with polycystic ovarian syndrome.
Okay.
So a lot of these things, like if we know
Mhm.
we have that, we don't always make the link that this is something that could predispose me to more health risks later in
Mhm.
life. And then, of course, there are others in terms of strong family history of conditions like these, which we definitely want to be aware of.
For sure. Okay, that's a good point. What about blood pressure and ApoB?
Yeah, so I think blood pressure, of course, across the board is very important. It affects our heart health, our brain health in terms of our risk for strokes, heart attacks, heart arrhythmias, and it's silent. So
Mhm.
if you
Yeah,
don't check it, you don't know what it's doing.
that's right.
And, there's no firm guideline on this, but I tell everyone in my practice or in my friend group, if you're over 40, please have a blood pressure cuff in your home
Yeah, I do.
and yeah, and check it periodically.
Yep.
A lot of times people feel like, oh, I went to the doctor, it was high. Oh, yeah, I have white coat. I always get nervous, but they have no other reads. And,
Right.
silent blood pressure is dangerous to our health. And the goal for blood pressure is less than 130 over 80.
Yeah.
And when we see normal blood pressures, sometimes we're like, oh my gosh, are you okay? That's a low blood pressure. And, the person's like, yeah, I'm great because we see so much high blood pressure.
Right. I had something happen last Christmas. It was about a 6 week stint that I went from my normal 110 over 70 to 145, 150 over 90. And it was a very scary time. I didn't know what was happening. I was in and out of the hospital a few times. They ran every test imaginable. Uh, I guess it might have been a virus or something that I was going through, but it eventually dissipated, which thank goodness it did. But I'll tell you, I was there with my chart every day, strapping into my little blood pressure monitor and listening and watching because one of the things that's really important is to know what's different for you, right? So a lot of people might have very, very low blood pressure, and that's normal. So even if I would go to the doctor and maybe it was 130 over 85, they'd be like, okay, something to watch. But I'm like, that's not normal for me. Normal
Right.
is like 110 over 70. And that's, I've always been that. So something's happening. And I made them do every test imaginable and we could find nothing. So that was good. But still, it's like, how do it's so important to check, folks. Yeah.
That's a great point to know you're normal.
Yeah.
And then your other question was ApoB,
Yeah. Yeah.
which
Let's talk
is
about that.
a lipoprotein particle, basically, in our blood, and is often a better indicator than LDL cholesterol. So oftentimes people are, checking their LDL cholesterol as part of their lipid panel.
Yeah.
Apolipoprotein B is not part of that routine panel. And the reason why it's important is because it's the actual, basically, cholesterol particle that is being carried throughout the bloodstream. And also, there can be discordance, meaning somebody can have normal LDL cholesterol
Mm,
and have elevated ApoB. So it's a much more comprehensive picture to at least have the additional ApoB or even having the ApoB by itself.
yeah. I ask for it. I don't think my doctor automatically screens. I mean, I've asked for it every time. I'm like, I need that one too, please.
Yes, and of course we want to know because we're trying to reduce the risk of the
Yeah.
plaques within the
Mhm.
arteries of our body. And we want to have the test where that's going to give a little bit more conclusive number for us.
I just have one final marker that I thought I read this in your content, so I just wanted to highlight this, but that sleep quality is an important marker and possibly our heart rate variability. I am freaking myself out currently because I have the ultra human ring, which is a sleep data ring that you can look at, and everything's pretty good except for my HRV, and I don't know if that is a glitch. I'm hoping it's a glitch because I'm like, I feel like I'm doing all the right things, getting adequate sleep, exercising regularly, trying not to over exercise, eating healthy. So, why is sleep quality such an important marker?
Yeah, sleep is a mechanism through which our body is restoring itself,
Mhm.
brain and, the rest of the body. But also, in terms of heart rate variability, we can think of it as it's a marker of how resilient our nervous system is. And we do have two components to the nervous system. And of course, sleep deprivation is one risk factor for having a lower heart rate variability. We want higher heart rate variability. All those sleep monitoring tools, show people like, okay, you only got 4 hours of sleep. If you want to help your heart rate variability, you need to be getting more adequate sleep. I would say that if the evidence shows that you're getting good sleep, you're not having multiple awakenings, I'm always very quick to check people for sleep apnea if they're having any issues and
Right.
to do a sleep study. But stress and that activation of our sympathetic nervous system does bring our heart rate variability down. And
Mhm.
so, I can't speak for you, but for
Mhm.
many of us, I think doing things that help to activate our parasympathetic nervous system
Mhm.
can help improve our heart rate variability. And some of those things are, of course, going to be what I call the rest and digest, right? So when we
Mhm.
think of our parasympathetic nervous system, there's a nerve that goes from the brain to the gut called the vagus nerve, and we can do things to help activate that. We can take deep breaths, go out in nature, working on helping to maybe even meditate and bring things down a notch. Those are also productive in terms of looking at that heart rate variability picture.
Mhm. As we finish off, what are some low-hanging fruit that we can do maybe even today? What would you say, like what is one of the most important things? People are listening to this. This is the new year. They're gearing up to maybe become healthier versions of themselves. What's some low-hanging fruit that they can pick today to move the needle toward better health?
Number one, be kind to yourself
Mm.
and give yourself a timeline that's realistic in terms
Yeah.
of the changes that you're making.
Yeah.
Number two, focus on what you want to add onto your plate. I think
Mhm.
everyone thinks about the stuff they want to cut out right away. And first of all, you don't need to cut out everything. I call these my non-negotiable foods. I always ask my patients, what
Mm.
is something that, like, if you never ate again, it would just be really sad? And if they have that certain food, I'm like,
Yeah.
let's keep that in your lifestyle on some level. So focus on addition. I would say fiber, because this year I'm hoping is the year of fiber because
It will
everyone's
be.
been focused on protein.
Yeah, for sure.
Adding lots of fruits and veggies and legumes and, whole grains as a source of fiber is a great focus on nutrition. And then I think in terms of movement, the move daily, I love that.
Yeah.
And finding small ways and large ways to
Mm.
move and focus on being stronger and what is going to keep us going for the long run. Short goals, they're fine for a short period of time, but what do we want to be looking at,
Yeah.
15, 20 years from now? I want to keep moving so I can keep moving.
Yep. I like it. I like it. Excellent. Well, thank you so much for being my guest today. That was very insightful. So thank you again. And let's let the audience know where they can find you and follow you or work with you.
Absolutely. Thank you so much for having me on. I am on all social media platforms as at Richa Mittal MD. I have a metabolic health website for women in midlife called Life Fully Nourished, and it's at www.richamittalmd.com. And last but not least, if you are within the state of Texas and would like to work with me on a medical basis, its website is myradianthealth.com. And thank you so much again, Tracy, for having me on.
You're welcome. It was great. All right, folks, I will link all of those things in the show notes below. So dive down there, take a look, and reach out and follow Dr. Richa because she is a wealth of information for sure. Now, to all of you, go move daily in 2026 in your fitness, your wellness, and your nutrition. And we'll see you all in the next Move Daily Talks.